Good day, everyone. All right, let me use this opportunity to welcome us all into today's class session. Hi, I'm Mr. Oyedino Joshua by name, and I will be the resource person that will be taking you through this course ANA 201 titled Anatomy of Upper and Lower Limb. Before we proceed, it is always good by the way of introduction that we know the overview of the course and the class session we are about to have. So this class session is going to be divided or is divided into 13 weeks of teaching, which should be done via online module like this. So I want to encourage us to endeavor to regularly check our module profile and our portal to get information if there is any needs be. And also, today's class session is going to be an introductory class. So, without any further ado, let's delve into today's class session. So, let me quickly take us through the course content, which are the descriptive terms and body planes, terms of relationship and comparison, muscle attachment and types of muscles, movement of joints, osteology and kinesiology, general organization of body systems, upper limb anatomy, lower limb anatomy, and applied anatomy. So, within the context of this course content, and at the end of this class, we are expected to be able to define the fundamental anatomical terminology and discuss the anatomical position, describe the anatomy of the musculoskeletal system, including the axial skeleton, appendicular skeleton, appendicular and axial muscles, and arthrology, describe the general features of the bones of the upper and lower limbs, identify the major muscles of the upper and lower limbs, explain the types and structure of the joints of the upper and lower limbs, correlate between the attachment of the muscles and their functions on the different joints, identify the major nerves of the upper and lower limbs, describe the functional components of each of the major nerves and its distribution, identify and describe the cause of the major superficial veins of the upper and lower limbs, and name the major arteries of the upper and lower limbs. So, introduction. I want us to quickly imagine or envision a boy which is on a bicycle and is on a motion, eventually fell down and is being taken to a hospital. So, a doctor which is about to treat such a boy, what do you think the doctor is going to do? The doctor is expected to check if there is any fracture or any rupture or any dislocation. So, what do you think help the doctor to diagnose or understand or know the exact location of this fracture? It is because of the help of anatomy that's provided us with knowledge in understanding the different parts and relationship between the component or the part of in which our body is made up of. So in this class, we'll be focusing on the anatomy of the upper and lower limbs, which we'll be covering the bones, muscles, joints, nerves, and the blood vessels. And I hope you agree with me that understanding the limb anatomy is essential for medical students as it provides foundation for diagnosing and treating conditions affecting mobility and function. So let's look at the definition of anatomy. Anatomy is the scientific study of the structure of living things, particularly the human body. So, the anatomy study the internal structure of the living things, particularly the human body. That is, looking at the gross anatomy, the internal structure of the living that are physical to the eyes. So, let's quickly look at the descriptive terms and body planes, and we have the terminologies in which we use in anatomy, which include the anterior, posterior, superior, inferior, medial, and lateral. So these terminologies are used to reference or describe a position or a view in anatomy. So it's a standard way of referencing a position and or view in anatomy. So you have the anterior, which is the front view of the part of the body. You have the posterior, which is the back view of the part of the body. You have the superior, which is the view from the above. You have the inferior, which is the view from the below. And you have the medial, which is the view you can see, the part of the body you can see towards the midline of the body, and lateral, which is the part of the body you can see, the view you can see away from the midline of the body. So you have the place of the body, which we have the sagittal plane, which is used to divide the body into right and left parts, You also have the coronal plane, which divide the body into front and back. You have the transverse plane, which divide the body into top and bottom. So let's look at the terms of relationship and comparison. The terminologies are also used in comparing different parts of the body. So you have what we call the proximal, which is used to describe the part of the body closer to the trunk. So if what is a trunk? So trunk in upper and lower limb in this context, it consists of the skull, the vertebra, and the rib cage. So while proximal is used to describe the part of the body that are closer to the trunk, the distal is used to describe the part of the body that are far away from the trunk. So we also have the superficial, in which it is used to describe this part of the body that are at the peripheral, that you can easily see. While the deep is used to describe the part of the body that are deeper into the body. So we have the musculoskeletal system. We'll be looking at the musculoskeletal system, and in this topic, we'll be looking at the axial skeleton, the appendicular skeleton, muscles, and the joints. So the way the musculoskeletal system works is that the axial skeleton, which consists of the trunk, which includes the skull, the vertebra, and the rib cage. This skull particularly serves as a framework, and this is a bone that helps to hold the brain and protect the brain. In which we also have the vertebra, which is the spine, which you can say to be the spinal cord, right? So you also have the rib cage, which these are the bones that are located at the thoracic region. And these bones help to protect these organs that are located in the thoracic region, such as the heart, the kidneys, etc. So this helps to shield these organs from external injuries. So we have the appendicular skeleton, which include the limbs and the girdles. I also have the muscles. So before I proceed, what the limbs does is that the limbs is the one that helps with the mobility. So the limbs include the forearm, the arm, the thigh, and the legs. It also includes the wrist, right, and the different phalanges, carpals, and metacarpals that we have. So let me just show the diagram representation of what I'm talking about here. So I have this is the skull, this is the thoracic region, this is the thigh, which is this is the femur, right, and this is the leg. So we are still going to talk more about this when we dive into the upper and lower limb. So this is the upper limb anatomy, and here we have the bones, which include the humerus, radius, ulna, that are located at the upper part of the body. So let me just take us through a diagram representation of that too. Also have this is a arm, right, and in this arm we have a bone called the humerus, and in this forearm we have two bones called the ulna and the carpus. So we also have the muscles, right, in the upper limb anatomy too. And what the muscle does is that muscles are attached to the bones, and they are actually the one that cause the movement, the mobility we are talking in question. The muscle are the one that cause this movement. And what tells the muscle that, oh, do this, I want to move. Okay, for example, if you want to move your arm, if you want to move your leg, what do you think? How do you think that process happened? So this is what happened. We have the nerve, such as the sciatic nerve, the median nerve rather, that in the upper limb anatomy, which helps to tell the brain. What this does is that it sends electric signals to the brain, and the brain now tell your muscle that, oh, this person wants to move his leg. It's not the muscle that now cause the movement. And when your muscle okay, let me just quickly take us through the process and how this works, but this is not going to be a detailed class about that. But then, so we have a process called the contraction and flexion. So this process is how you move your legs or any part of your body. When you contract, when your muscle contracts, it decrease the angle between that part of the body, and when your muscle relax, so that's the process called flexion, right, which increase the angle between any part of your body. So let me just quickly take us to the lower limb anatomy too. So in the lower limb anatomy, we also have the bones, we have muscles too, we have the joints, and we have the nerves and blood supply. And in the lower anatomy, we have the bones such as the femur, tibia, and fibula. And the major muscles we have in the lower limb anatomy are the quadriceps, hamstrings. And permit me, let me just quickly give you a general concept about joints. So I didn't talk about the joints located about in the upper limb anatomy. So in the upper limb, you have ball and socket joint and the what and the hinge joint. Ball and socket joint are found in the shoulder and the what and in the hip. So the hinge joints are found at what? They are found at the elbow and at the knee. So here, I'll talk about the nerve the other time. So the sciatic nerve, that's the nerve that helps to send signal to the brain in the lower limbs. So we also have the femoral artery, which helps to what? Which helps to supply blood to the lower part of the body, that is the limb, that is the thigh and the legs. So this is a diagram representation of what I'm talking about here. So in conclusion, I hope you agree with me that the knowledge the anatomy has provided for us is very crucial for diagnosing and treating musculoskeletal injuries. The anatomy of bones, joints, muscles, and nerves plays a central role in mobility and overall limb function. Uh, Thank you very much for staying with me to the end of this class. Also, I will be sending us a resource material for this class, in which I want us to go through this material, and I would like us to watch this video again. And if you have any questions, please don't hesitate to ask me. Drop any questions you have in the text box and the comment section. So we shall meet in the next class, and I'm expecting you to bombard me with a lot of questions, right? Please, I'll be so happy to see you do that in the next class. Thank you very much for staying with me at the end of the class. See you next class.